It's a rainy day up here in Maryland. What's it like where you guys are at? You still got snow? You getting springtime weather? Where are you at in the world as we have people jump in here? Let me know. I'd love to know. Um, yeah, I had a late start this morning. I always have a late start. I mean, I get up at 5:30, but you think that would be early enough. Okay, so today we were going to talk about medications that they prescribe for diabetes, and through the lens of Dr. Bickman, who wrote this book, Why We Get Sick. So, through the lens of a metabolic specialist who talks about insulin resistance, how insulin affects the body and our health and leads to all this stuff here. The information I'm bringing is from him, not me, but let's try and dive into it and see if I can relate some of the information. Tomorrow, I would love to, if anybody wants me to, go into GLP-1, things like Mounjaro, Trulicity, tirzepatide, whatnot, more in depth. But today we're going to just go over a couple of them. But first, let's talk about insulin resistance. So you need to understand insulin resistance in order to understand how these drugs are working and why I'm not an advocate for them. Dr. Bickman's not an advocate for them, and why the protocol that I use is really what I believe in for diabetes and all this insulin resistance related stuff. So it's a more natural solution. We'll get to that in a little bit. But what you need to understand is that insulin resistance is just a disease of too much insulin. And why are we having too much insulin? Good morning, Bobby. Because we have too much glucose. Now, it's interesting listening to Dr. Bickman because he says this a lot and he's saying it more and more. But let's differentiate between type 1 and type 2 diabetes. First of all, we'll talk about that in a second, but there is a big difference. So I'm not talking about all types. But insulin resistance diabetes has traditionally been seen as a disease of too much glucose. But by the time we start to read too much glucose in the system, there's been too much insulin for a very long time, could be 20 years before it ever becomes too much glucose and now you're sick and now you're having problems and the doctor says, oh my God, you're pre-diabetic, you're diabetic, we got to deal with this, when there's 20 years of damage that's being going on in your body and nobody's catching it or talking about it. So it goes like this. The food we're eating is imperfect. It is either way manufactured, stripping it of enzymes and nutrients, or it's been genetically modified and crop rotation hasn't been happening. We just aren't getting the nutrients we need out of our food. So in order for us to get the nutrients that we need out of our food, we would have to be eating far more. Some of the nutrients are less than 50% available in foods now than they were 50 years ago. So that means you'd have to be eating twice as much to get the nutrients. This is why we get to supplementation, and we'll talk about that in a little bit. But it's almost, I wouldn't say impossible, but getting close to that to get the nutrients we need out of the food we have today, whether you're talking raw organic food or whether you're talking boxed and bagged food. Now, raw organic food is going to be better. Obviously, I'm not saying that, but we have flaws with all of it. So we're eating too much food, and the food that we're getting isn't giving us nutrients, but what it is giving us is a lot of glucose. Now, glucose is basically sugar in your bloodstream. And most of our food converts into glucose, which is a source of energy for our bodies. Every single cell in our body has an insulin receptor in it. Every single cell in our body needs that energy in the form of glucose to be able to replicate, to do its job, to do whatever it has to do. There's a lot going on cellularly for us all the time, every day. Our bodies are insanely working every second of the day. So we need that energy, right? But in the presence of too much sugar, what's happening is the pancreas produces this hormone called insulin. Insulin, one of its main jobs is to transport that sugar to the cells and get it into the cells. So not only is it the transport system, but it's got like the lock and key. It's got the gate code to get the sugar into the cells. So we're going to talk about that in a second. If you'll give me a minute, we need to understand insulin resistance first. So when we have too much sugar it produces too much insulin, and now our insulin level, so every time our sugar level rises, our insulin level rises. Sugar drops pretty quickly, but insulin takes longer to come back down. Protein, fiber, and lots of water. That's pretty good. That's partly where I'm going to go with it. And the fiber I use is specifically designed to help with this whole insulin resistance problem. Not all fibers are. So too much insulin too often causes insulin resistance. What that means is our body's being inundated with the substance that was once healthy for us, but now the body sees it as a threat or an annoyance, and it starts to go defunct. So all of the stuff above can show up with insulin resistance. So diabetes really, according to Dr. Bickman, is a disease of too much insulin, not too much sugar. Hey, Mrs. Kim. So we got to understand that to understand the flaws in these drugs we're going to talk about. So the one I get asked about the most is metformin. And I learned a lot about metformin doing this work for you guys. I still have a lot more to learn. I'm going to admit that because, look, I'm just a normal human being trying to stuff all this knowledge in my head. But metformin, Dr. Bickman says it's one of the ones that he would most recommend. However, even though it's the most recommended by most doctors, we're going to talk about a few things that are happening with metformin. Number one, it's the most widely available and most cost effective because it's off brand. So it's the one that doctors would recommend the most of the time because it's on most insurances formularies and they're going to pay for it because it's cheap, right? But at the same time, it's the least understood. The mechanism of how metformin, why I was mixing up mechanism and metformin, how metformin works is not yet fully understood. They think that it has something to do with the mitochondria, the little powerhouses in our cells, right? Levothyroxine, let's answer this question. Yeah, it makes you have diarrhea, though. We're going to get to that part. And Mounjaro and levothyroxine, the levothyroxine, I think you can do, for me, what I chose when I was doing thyroid therapy a lot was more of an Armour or natural thyroid than the levothyroxine. And I would get with a doctor who understands what thyroid you're needing and make sure you're getting something maybe compounded if you can. Mounjaro, no. And we'll talk about more about Mounjaro and why no tomorrow. I'm going to talk a little bit about it this morning. We're going to talk about that in a minute. But metformin, yes, it gives you intense gastrointestinal distress, bubbling, gurgling, nausea, vomiting, diarrhea. That's the worst part of it. But the crazy part with metformin is this. You see guys like, I think it's Brian Johnson and a few other people who talk about using metformin as anti-aging, right? But what metformin does in the body, Dr. Bickman, after doing some study on it, they think that it's actually inhibiting the mitochondria function in your cells. So now what happens is when you're exercising and you're trying to be youthful and be more insulin sensitive, the metformin is acting like it's down regulating the effects of your exercise. So you're just not getting the full amplified effects from doing even cardio when you're on metformin. And then we look at weight bearing exercise. Now it's stopping or slowing down muscle building. So metformin and weight bearing exercise is really counterintuitive because if you're trying to gain muscle mass and you're taking metformin's going to block that muscle mass growth. So not a good fit, right? Probably the best of them, but yes, like Mrs. Kim said, intense, extreme diarrhea, nausea for most people. So that's that. The next one we want to talk about is insulin therapy itself. And this is where we get the difference between type 1 and type 2, right? Type 1 diabetics cannot produce insulin. Type 2 diabetics are just having a problem with being insulin sensitive. But type 2 diabetics are able to produce enough insulin. Their body just isn't dealing well with the insulin they're producing. So you go into a doctor and they give you insulin injections because they're still viewing it as a disease of too much sugar and not too much insulin. So when they're seeing it as a disease of too much sugar and they're thinking what counteracts sugar in the body, well, that's insulin. So let's give this person more insulin so that their sugar will come down. But what's happening is you already have a disease of too much insulin where your body's shutting down to insulin in many of the cells, and you're making that part worse. So according to Dr. Bickman, there were three things that he said directly are getting worse on insulin therapy for type 2 diabetics. By the way, the natural protocol I talk about works for type 1 and type 2 diabetics to be more insulin sensitive. So type 1 diabetics have to take less of their insulin. So he said it slows the production of glucose in the muscles, okay? But the bad parts are the nausea, the GI distress. Um, it blunts the body's adaptation to exercise and blunts muscle growth. But it's also, that was I'm talking about insulin. So it creates an increased risk of cardiovascular disease, an increased risk of cancer, and an increased risk of Alzheimer's. When they've done studies on people who are type 2 diabetics taking insulin injections, they become they become laden with Alzheimer's much quicker than people who aren't taking insulin therapy. The other thing is when they did a study on a section of fat cells, and the section of fat cells was pulled from in and around where insulin injections had been being given on a person, and the direct site of injection, as opposed to the cells just around it, that direct site where insulin was being injected had 10 times the fat cell volume as the other cells. So insulin is making you fatter quicker, and it's making you sicker quicker, and it's potentially killing you quicker when you're type 2 diabetic. That comes from Dr. Bickman, and he's told many physicians that himself. So that's insulin. I just want to make sure I'm not missing anything. Mrs. Kim is on the system I'm doing, and she has lupus, and she's getting better on this system that we're going to talk about. But I want to go over your drug options so you can see the difference, okay? So insulin can increase your risk of cardiovascular disease, your risk of cancer, and your risk of actually it's making you fatter, but Alzheimer's. So those are high risks with insulin. And why would you be getting something that you're already having too much of in your system? Because they're looking at the model wrong, because they're seeing you as somebody who has too much blood glucose instead of somebody who has too much insulin, that the insulin's no longer working right. So then he's talked about these things called insulin secretagogues. So it would be things like glipizide. The izides are insulin secretagogues. And this one gets into more than I'm ready for. There we go. Okay. So many of them, what they're doing is they're forcing insulin secretion from the beta cells within the pancreas. So right alongside of insulin, same issues: increased heart risk, increased cancer risk, increased Alzheimer's risk. So those izides that they're giving you for diabetes are forcing your body to produce more insulin, which is wearing your pancreas out, is the other part of it. So now the pancreas is really overtaxed, and you're having more and more issues. You get better for a while, but then it takes an increase. I mean, how many of you guys are on these medications and it seems like you're just getting increased doses? You never come off of them. Why? Diabetes is reversible. You don't have to be on medications the rest of your life. Okay, so GLP-1s, Mounjaro fits in there, and we're going to talk more in depth about GLP-1s tomorrow. But GLP-1s, what he talked about was, and I've said this before too, because I had heard it from some scientists, and they were, I believe, mistaken after listening to some other doctors. And so I'm going to correct what I said earlier about GLP-1s, because I used to say that they forced you to produce more insulin. A lot of scientists think that that's what's happening with it, but when they look at it deeper, they're thinking that GLP-1s, Mounjaro, Trulicity, Tirzepatide, semaglutide, Ozempic, are increasing insulin sensitivity, or they're increasing the insulin's response to glucose. So they're increasing how insulin responds to glucose. But they're also inhibiting the release of glucagon. Now, glucagon, if you've listened to me talk before, we have two of these hormones that they're like the yin yang of your metabolic hormones. They're many metabolic hormones, but these two main ones. Insulin is a saver. It wants to take things in and save it. Glucagon is its component, but it wants to spend things. So in your metabolism, you're either living off of sugar, running off of sugar. Here's your motor running off of sugar and insulin to deliver that sugar. Or you're switched over and you're running off of fat. So I think it was Mindy Pelz who said it's like we're a hybrid car. Sometimes we got to work off of the sugar, but sometimes we can run off of the fat, and we're supposed to be able to do that. Insulin turns food to energy. Insulin carries the energy from the food. So the liver is creating the energy by creating the glucose, and then the insulin is transporting it to the cells. So we want to be clear on that. Insulin doesn't convert your food to glucose. Your liver does that. So yeah, Mrs. Kim, 56 years until you started this product. Um, so I'm giving people a better option than these medications to deal with diabetes and insulin resistance and a number of the things up here. Like Mrs. Kim has gotten rid of carpal tunnel and neuropathy. Her lupus is better managed. A number of things have gotten better for Mrs. Kim. So now we talked about metformin, we talked about insulin, we talked about insulin secretagogues, the izides, right? Now we're talking about GLP-1s. So they do enhance insulin sensitivity, which is exactly opposite of what I thought. But by lowering the glucagon production and response, you're also not getting the natural fat burning. Now, along with the insulin sensitivity, you're not getting, and glucagon, by the way, when glucagon is out is when we're having HGH response, when we're having ketone response, which means we have some good muscle building. But remember, GLP-1 is stopping that. It's stopping that. So there's a reason why people on GLP-1s who are doing it for weight loss, 40% of their weight loss comes from the muscle mass they lose, not just fat mass. Okay. Cutting processed carbs will do the same for type 2 diabetes. Yeah, it can. It can. But getting fiber in to deal with, we're going to go into that, how the fiber helps with the production of carbohydrates into our system. And look, it's not just processed carbs. It's bananas, it's cantaloupes, it's watermelon, it's peaches. It's a number of things that we eat that don't have enough fiber in them to mediate how the sugar or the fructose or glucose gets sent into our system. So GLP-1s, now according to Dr. Bickman again, it inhibits the liver being able to process and store the sugar. So I need to look more at that. But the big part of the GLP-1s is the delayed gastric emptying. So you feel full all the time. It has an action in the brain, the GLP-1s do, where it kind of triggers a sense of satiety. But in the gut, it's almost like freezing up your gut. So your intestines and your stomach and your gallbladder and stuff just aren't contracting like they should. So the passage of the food through your system goes much more slowly. That means you feel fuller longer. The system that I do does something similar, but not by freezing up your gut, by making your gut work better and by giving you the nutrients you need. Big difference, and we'll get to that in a minute. But the GLP-1s, for as far as the diabetes goes, that's what Dr. Bickman had to say about it, and we'll go more into depth on his views on GLP-1 tomorrow for weight loss. But then we look at, oh, I can't even say it. Thiazolidine. Anyway, another class of insulin resistant or diabetes drugs. What they do is they act on these pathways that especially in your kidneys and in your liver. So they work on two different pathways called SGLT pathways. There's one and two. And SGLT pathways do have something to do with glucagon and whatnot. But what's really happening is with the SGLT ones, and I have to look, they block the absorption of sugar. So instead of your liver being able to take up the sugar and convert it and pass it back out to the body as energy, it's forcing you to dump that sugar out. Now you have diarrhea. Now you have gastrointestinal pain, and you have all this gut issue nastiness. The second one that works on the SGLT2 pathways is acting in your kidneys. So those SGLT2 pull sugars from there's these little slits and tubules in your kidneys, but it pulls the sugar through those tubules and you effectively urinate them out. But what the drug is doing is it's inhibiting the production of SGLT2. So now you're not able to hold on to salt, which when the salt pulls in, some sugar pulls in, but instead you're excreting it. So now you're going to the bathroom a lot and you're peeing out all the sugar. So your blood sugar is dropping because it's not hitting your bloodstream. It's being forced out through your kidneys, overworking your kidneys. You end up with more UTIs and urinary tract infections because there's just a lot of bacteria in that tract. And now you're passing a lot of sugar through it. That's salt is actually good for you. And I say that all the time. So when people are talking about salt and heart disease, we talked a little bit yesterday about how insulin resistance causes a number of problems with blood pressure. And this cut the salt actually has to do with too much sugar, causing your kidneys not to be able to produce aldosterone in the right amount. So now you have a sugar dysregulation or a salt dysregulation problem, and where salt goes, water goes, and your blood volume goes up, and that's causing blood pressure problems. Yeah, the sugar causes you to hold on to the salt. Absolutely right. So look, all of those drugs, we heard all about them, and I hope you can see where they're going right, where they're going wrong, and why we're just not an advocate for them. So at the end of all of that, yes, the system that Mrs. Kim uses, that I use, is two real food products, not medications, that are helping people regulate their blood sugars. In fact, it has science behind it and clinical studies behind it. And because of that, it's allowed to be in the prescriber's digital reference. Metamucil and Benefiber aren't in there because they don't have the studies or the proof that this is happening for them. But this product does. So it's a tea that I have every morning. And by the way, we're going to check in on my 36 and 12 fast right now. And hopefully you guys that are doing it check in with me as well. But so I just drink a tea. I mixed this up in some hot water this morning, and that's my tea for the morning. It doesn't break my fast. It actually supports my fast. And it gives me mental clarity, energy. It gives me some of the same effects of those GLP-1 drugs, but in a very different way. So similar to the GLP-1s, it's shutting down hunger in my brain because it's getting nourishment to my brain, not because of some artificial signaling pathway up there. It's actually getting energy to the brain that's allowing those hunger cues to shut down because the brain isn't starving. Then it goes into my gut and it gives me a little bit of a satiated feeling, just a little slightly distended feeling in my gut to make me feel like, ooh, I'm not as hungry as I thought I was, but it's not freezing my gut. It's not slowing down the emptying of my gut. It's not doing any of that. So the satiety from it is very different action than that of the drugs that are causing this slowdown and actually have been proven to have caused gastroparesis for many people. Then the second part, on a normal day, like yesterday when I ate, and I'm sad I only ate 2 meals yesterday, but before both of the meals I just had one of these, which is 7 different soluble and insoluble fibers, phytosterols, and vitamins and minerals specifically designed for the metabolism. Now, the system works so well that there's a 90-day money-back guarantee on it, in as far as it will reduce your A1C, your blood glucose, and your triglycerides within those 90 days, or you get your money back. So, and it's just food that's doing the job. So it's really just putting back the nutrients that have been stripped out of our diets, allowing our body to deal with things like sugars more properly. This, in fact, has reduced a blood sugar spike by 20% when tested on white bread. One of the most high glycemic foods out there, still reduced the blood sugar spike by 20%. With that means a lessened insulin spike. And when you do that over time, now your insulin starts to come down to a normal level, and you can metabolically switch between insulin and glucagon. And now you have a body that saves energy when it has food available and spends energy when it's appropriate. And by the way, the spending of the energy, what we're going to get to now, is the fast I'm doing, right? So, but before we do that, if you're interested in the system, look, you can just get it. Go to my profile link, tap on the link up there. I've had a number of people tell me my link doesn't work, and yet when I have outside sources test it for me, it's working. So here's the thing: before you say my links aren't working, because I just had them all tested yesterday, check your cache, check your phone history. Do you have pop-up blockers installed? Do you have some of that going on? That could be part of the problem. You might just need to restart your phone and then try it again, and it usually works. Okay, so the products are found up there. It's what saved my life. My blood pressure was 185 over, or 180 over 150 every single day at some point before the system. And now my normal blood pressure is 110 over 70, no medications. I got put on metformin in the beginning of my diabetes journey. And I, like Mrs. Kim said, I had horrible problems with it. I felt sick all the time. I just felt like painful from the inside out. And the nausea, vomiting was real. In fact, it was like one night I woke up in the middle of the night at my daughter's house, and projectile everywhere, all over her kitchen and her bathroom. And I had to spend the next 2 hours cleaning up. So that wasn't a drug that I really liked. I never got put on the other drugs because I just don't believe in them. And I read all the stuff before they weren't listing it in the PDR anymore, of how damaging they can be. And so I'm just not a proponent of those. Why not? I'm not belittling anyone. I'm educating people on the reality behind those medications. And life-saving medication would be insulin for type 1 diabetics, right? That's a life-saving medication. Giving insulin to a type 2 diabetic is not life-saving. It's life-damaging. It's shortening their lifespan. So, and some of these other drugs that are causing other problems, if we understood what the real problem is, and so this is what I'm going to invite you to understand. Triple T dad of TikTok, okay? That just because I'm educating people and just because it hits you wrong doesn't mean I'm belittling anyone. We've all been taught and taken what we've known from our medical providers, who are giving us what we believe that they're telling us is the best for us. But science is not always in alignment with that. So if I'm telling people that, you have an increased risk of pancreatitis, of liver problems, of kidney problems, of thyroid problems, of gastroparesis from these drugs, and that there's a more natural alternative, what kind of asshole would I be to not tell people that there's something that's not causing all the damage, but is actually supporting them and their health from the inside out? So I do a lot of education, and I'm not belittling anyone, because we're all where we're at, but I'm educating people on what is the reality of these drugs. Because are you getting did any of your doctors tell you any of this stuff about these medications before they put you on them? Type a 1 in if your doctor told you any of this stuff before they put you on any of those medications. Okay, so let's not get our feelings hurt if we don't. Yeah, the truth is the truth. So you're hungry all the time and you can't control your diabetes. So we're going to talk about the 36 and 12 down GLP-1, now down 297 pounds. No, I'm not saying that it doesn't cause weight loss, and I'm not here for that argument. It does cause weight loss. But when you look at the long-term effects, and you look at the fact that if you're over 40, you already have a hard time putting muscle on, and now you're taking a drug that's actually causing you to lose 40% by science of the weight loss is muscle. And if you're over 40, the likelihood of gaining that muscle back is very little. So now you've become less insulin sensitive. Now there's a lot of people who have lost a lot of weight on these GLP-1 drugs, but I've also talked to a lot of people who came off of them, started gaining the weight back, started going back on. I've had calls from people who've lost their thyroid, calls from people who've lost their gallbladder, calls from people who've lost their liver function, all from these drugs, and some people who've had the gastroparesis. So, yeah, I mean, I'm glad that it's working for you, but at what cost? At what cost is it working? Because it's not. And let's talk about this too. You are not deficient in a GLP-1 drug. You are deficient in nutrients that are allowing your body to cope with the food that we're eating properly. That's what we're deficient in. You're not deficient in a drug. So it's just a paradigm shift. And GLP-1 is not insulin. I understand that. So, okay. So diabetics get gastroparesis without medication, and I've done whole talks on how that happens, right? So diabetes can cause that. That end stage insulin resistance causes some nerve damage and some nerve functioning problem, which allows the body to stop contracting as much, and that's how they end up with gastroparesis. So if a drug is stopping you from moving food through, isn't it the same thing? But diabetics, so you're diabetic and you're taking a drug because you don't want to get gastroparesis, but yet one of the functions of that drug is to slow down the emptying by slowing down the contraction rate and force of your intestines and your gut. So it's, that's a whole yeah, this will be on YouTube afterwards. So just Brilliant Health with Misha on YouTube, and it will be up there. Okay, so the not the medications, the system that I use and that I love, because I'm not a proponent of medications. I had two very close family members who worked for Big Pharma, saw what was going on. I worked in medical, saw what was going on, not a proponent, okay? So when I stumbled on this system, I had type 2 diabetes. I had a walker and a cane. I was having problems walking. I was losing my joints. I was losing my eyesight. My teeth and gums were bleeding. My hair was falling out. I was a wreck. Medically, I was a wreck. And my doctor was terrified for my health because we're friends. And she was like, I don't even know what to do. And a previous doctor called me into her office and said, you have the worst metabolic type that I could have had come into my clinic. There's nothing I can do for you. Okay. So then I was on 13 different medications. And today I take no prescribed medications. I just do this system based on natural foods. So instead of damaging my body further and further, and I saw it enough in the medical clinics when I was doing intakes of patients and I was doing all the input of their medications and seeing what they were on and why they were on them, and saw how many medications they were given just because it was dealing with side effects from other medications that they were given. They started off with one or two, and because of all the symptoms and side effects from them, they ended up on a bag or 2 bags full of medication. And yet, most of us are not deficient in medication. There are some genetic and viral and infectionary things that we need medications for. Not going to deny that. But in our everyday life, is it the fact that we're deficient in a medication that we're getting sick? No, it's not. It's the fact that we're deficient in a super nutrient called fiber that's helping us slow down how our sugars are relating in our body, plus we're not getting in enough protein, plus people are doing the whole calories in, calories out, calorie deficit thing, which causes muscle loss. Um, so instead, if you nourish your body and make some changes, like do a little bit of 16-8 fasting, which is not starving you, it's not depleting you, it's not causing you to not get enough nutrients in the day. You're just allowing that switch between insulin and glucagon to happen when you do that 16-8 fast. So I'm doing a 36 and 12 every other day fast. Today is day 5 because it's the 5th. So today is a fasting day to me. Tea, water, I don't drink coffee, or bone broth is what I'm having today. Why? Because it kicks off this thing called autophagy that's turning over cells, that's helping my body learn better to burn fat for fuel, that's getting rid of junk cells so my skin can be firmer, so my brain function can be better, so my heart function can be better, so my gut is more clean. And that's why I'm doing a 36 and 12 fast. But not everybody has to do that. I'm doing it because I'm 60 and I've had more than 40 years probably of insulin resistance going on, and we need to clean some stuff up, right? So I'm taking extra measures. But I'm not even hungry yet. It's 9 in the morning. It's been more than 12 hours of fasting. It's been 15 hours of fasting as normal. The tea shuts down my hunger. Plus, it tastes great. Plus, it helps me kick out HGH or ketones. It helps me with brain clarity. It helps get, there's chlorogenic acids in it, which are one of the components that can cross the blood-brain barrier and get nutrients into the brain. It has all of that going on for it. And it actually helps me go into autophagy more than if I was just drinking water. So the tea is what I'll be doing today. I haven't done the fiber on my fasting days yet. The fiber, interestingly enough, because I did some stuff on myself, when I was in a 10-day fast, several days after not having food, I decided to see what would happen if I added the fiber. My ketones actually went up. And why do I talk about ketones more than I talk about a glucose monitor? I think a glucose monitor is really important, but even in the absence of food, your body starts taking these junk cells and repurposing them and finding energy out of them. And so your glucose levels will rise and fall in a fast, even without putting food in your mouth. Somebody wrote, "What kind of tea, bone broth?" That just threw me. That just threw me. So tea is one, bone broth is another. Um, Anything now, they said you can do vegetable broth, but I just stick with bone broth. Um, it's healthier, and I do some electrolytes on these, especially on the fasting days. I do them every day, but especially on the fasting days. Good morning, Karen, if you're still in here. How can type 1 fast without having low sugars? So you would have to be able to pay attention to your insulin levels, right? So it's not just the sugar levels. You're taking insulin as a type 1 in response to the sugar that you're eating. Okay, so insulin is lowering that. Now, if you're not having sugars come into your body, and by the way, when your body produces glucose or energy out of these cells as it's cleaning your body up, there are back doors or other receptors to get the energy into the cells. So it's not like insulin has to spike to carry that. There are back doors into the necessary cells that need the energy. But it would be more difficult, and I'm not as versed on type 1 diabetics. That's something I probably should look into. We have a number of type 1 diabetics who have been successfully doing this, the 16 and 8 fast. They just simply are not using as much insulin, because the insulin is there to reduce the sugars that you're eating. And if you're not eating the sugars, you need less of the insulin. We really need the minimal amount of insulin to deal with the sugars, and that's all we need. We don't need high amounts of insulin in our system. It's just there to it's not just there, but the primary job is to transport energy and get it into the cells. So if you're not having that energy in there, then you don't have to have the insulin, and the high levels of insulin that you're injecting are causing your blood sugars to go low, because that's what they're there for, right? But if you can start to manage this, and that's why we have a number of people who are type 1 diabetics, including a family member of mine, who started this, and their insulin load dropped dramatically because their blood sugar levels weren't spiking constantly. So it's probably a longer road for you with type 1, and you have to be much more careful. I'm probably not the person to talk to you about that in depth. It would probably be your physician, or if you can find one that understands fasting, check them out. Check Dr. Fung's work on fasting out and see what he has to say about type 1 diabetics. Um, have a great day, Mrs. Kim. Okay, so the tea again is just this tea. I have it in lemon. I have it in lemon ginger. I'm drinking the lemon ginger now. I did not like the lemon ginger at first, but it's like my favorite tea now. And by the way, ginger actually stimulates autophagy. So having this lemon ginger tea, the green tea stimulates autophagy, and the ginger stimulates autophagy. It's just helping me on my fasting days. And it's actually much easier. Day one, if you were with me yesterday, day one was tough. That really sucked. I'm not going to lie. I wasn't ready, but I let myself get out of control, right? So I'm like, okay, you're going to do this 36 and 12 fast. You're going to get yourself back under wraps, and you're going to get this thing done. But day one was rough. Not the roughest I've been through, but that breaking that need or want to eat was pretty intense. And the day two, the rebound eating, I didn't do too much because I was aware of it. But then day three of a fasting day again was pretty easy. Now, day four, I didn't eat as much. I was a little upset, not because I didn't eat as much, but because I didn't get as much nutrients in as I had planned. And so today is a fasting day, which just means that tomorrow I need to be hyper vigilant in getting in my nutrients. Omega 3s I need to make, which I can take today. But my fiber and my protein and the healthy fats that I need, and the micronutrients, I need to make sure all of that's going in tomorrow. So it's not like a starve one day and starve the next day. You're letting your body do some magical work one day, and then the next day you're refeeding it with healthy food so that it can do that magical work again the following day. Okay. So this makes, I know a lot of people who do the system, and they do it through Ramadan, and they've said it's made it like, I don't follow all of that, but I know there is a way they do this through Ramadan, and it makes it much, much easier. So if you're interested, let me know, and I will reach out to the people who do that with this system, and they've all raved about how much easier Ramadan is for them with the system. um, Went from type 2, clothes was extra large, now your diabetes is in control, and reversed down to a size large. Yay, Mrs. Kim. So that's just one story. Mrs. Kim's story is just one, but we have many, many stories similar to that. Because weight loss is what we all want, but it's not the real goal. There's so much I didn't get to talk to you about this morning. One of them is fat cells. So the last drug that I was having problems saying, and once I'm done with the live, I can probably say it just fine. But what the last anti-diabetic drug does is it increases your fat cells, and GLP-1s can do that too. So here's just a really short, brief, like super, super simple level of fat cells. Some people can make more fat cells over their lifetime, and some people can't. The fuller a fat cell gets, the more insulin resistant it starts to become. So there can be some benefit to having multiple smaller fat cells. It doesn't mean you have less fat on your body or less size. It just means that you have multiple smaller cells, and because they're smaller, they're less insulin resistant. And the smaller fat cells are also not inflammatory. So somebody who just has the same fat cells and they're getting really big, they're having a lot of inflammation and they're starting to have insulin resistance, and they become diabetic much quicker at a smaller body size than somebody who's replicating fat cells, and their fat cells are duplicating, so they have more fat, but the cells are smaller, so they have less inflammation and their blood sugars stay normal longer until those multiple fat cells start to get bigger and bigger and big enough that those fat cells become insulin resistant. Okay, guys, tomorrow I do want to go into GLP-1 drugs. Again, people who are finding success with it, that's your path, and I'm not going to take that from you. But here, I'm not a proponent of those drugs because they've been shown to damage gallbladders, pancreas, liver, and thyroid, and cause gastroparesis, just to name a few things. And there's reasons why that's happening. And look, it can be a quick way to weight loss, right? It can be. But if you've not seen the documentaries of the people who've had severe reactions and results and ended up in the hospital from them because of the things that I'm telling you, go look. Go look, and then make your choice. If that's what you choose to do, that's your life. It's not mine. But in my life, I would rather take the little bit longer road and know that I'm building health, because that's giving me a longer road instead of a shorter road. I could be skinny today and be taking Ozempic and have shortened my lifespan, or I can put up with a few things that I'm still healing in my body and get my body healthy and live longer to be here more for my family that I love so much. So it's a choice you all get to make. Now, if you're interested in the system that I'm doing, I don't talk enough about it because that's what I'm really here for. It's a tea in the morning and a pre-meal drink before I eat anything. It reversed my diabetes, my hypertension, my teeth and gums bleeding. It helped my eyesight start to come back. I'm in the same diopter glasses as I was at 45, now at 60, when 2 years ago they were twice this. My hair is growing back in. My skin is better. My sleep apnea, you guys, I did not want to get out of bed this morning. I was sleeping so hard. I think my alarm startled me. That's unusual. From a woman who had sleep apnea so bad that I woke up 60 times a night, and all I've done is add 2 real food products to my day at 3 points. Tea in the morning, a pre-meal drink before I eat anything. And it's helped people like Mrs. Kim, my brother, my daughter, my grandchildren, and so many more people that I'm on the phone with all day about their health. Now, I do want to say this. I was on the phone yesterday with someone about her cholesterol levels. Some interesting information before I hop off this morning, because I have a few extra minutes with cholesterol. She called me and she was upset because her blood pressure was still high after a year on the system, and her cholesterol levels, her total cholesterol, she felt was high after a year on the system. So we broke it down. And when we broke it down, she had been under a lot of stress, and she had a severe medical issue that was causing inflammation and pain and a number of other things. Plus, she has a joint that's going bad and pain and inflammation there. All of those things can cause an increase in cortisol and an increase in your blood pressure. So, does the system solve everything? No. You still have to take care of yourself. You still have to watch your stress levels. You still have to watch what you're doing with other things. And if you want a healthy life, you've got to start to be more healthy with yourself. We had a meeting last night that went on till 10:30. I get up at 5:30. By the time I wrapped it up and got to bed, I didn't get enough sleep last night. So I'll work on making sure I get enough tonight. But you guys get good sleep. Eliminate your stress levels as much as you can. Do some meditation. Focus on some gratitude. That will help the cortisol levels and the blood pressure. It's not just about getting the sugar down. It's about lifestyle as well with some of those things. Now, as to her high cholesterol, this is where I really wanted to go with this. I have heard so many more doctors, especially heart surgeons, talking about how they don't, sorry for my language, they don't give a shit about the total cholesterol number. And here's why. Because if you look at your triglycerides and your HDL, your triglycerides are low, your HDL is high, your total cholesterol may look different than otherwise. So that total cholesterol number isn't as important to them as just looking at the triglycerides to HDL. Now, if we take a look at that, what it's really doing is telling us how much of the damaging type of LDL is being produced in our system with insulin resistance. So that calculation is in my tab, How to Tell, but I'm going to tell you again right now because this applied to the lovely lady I was talking to yesterday. Her triglycerides were like at 97 and her HDL was at 56. Now for women, it's 40 or more. So 56 for HDL was phenomenal. 97 was it 97 or 79? Anyway, when I did the calculation of divide the triglycerides by the HDL, she came in at 1.33. A big difference from a year ago in that same calculation. And that means that she's more likely to be insulin sensitive. Now, there's other things in your life that can come in and cause havoc, right? Insulin is not the only thing, but it's the big thing. So how can you be tested for insulin resistance? It's a great question. I haven't talked about this for a while, so let's go over some quick ways you can tell. You can do a test, and if you go to my tab, How to Tell, there is a calculation using your fasting blood sugars and your fasting homeostatic model assessment of insulin resistance, HOMAIR. It should be able to be drawn out of the same tube as the rest of your metabolic panel. So it shouldn't be an extra tube draw for you. It just is an extra test added to your labs. HOMAIR, and it's in that video. But you're going to take your glucose, your fasting glucose, times your HOMA-IR, and then divide it by 407. That whole calculation is in my tab in depth of what that looks like, whether you're in the US or whether you're in the UK or other countries who don't measure like we do. But that's one way, right? You can take a look at that panel that I just talked about. Divide your triglycerides by your HDL. If it's 1.5 or more, if it's more than 1.5, then you're probably having a problem. If it's more than 3, you do have a problem, and that's how you can tell. Nobody really is testing for it. They're running the HOMA-IR, but the HOMA-IR on its own is a very simplified test and not giving you a real picture. So getting tested for insulin resistance can be complicated. Some doctors think they know, but I would use those calculations regardless of what your doctor says and see where you land on the scale. Some other things just for you to tell. If you have more than 2 of those things on the list, you're probably insulin resistant because all of those things link back to insulin resistance. So other indicators, the top 5 indicators that I talk about are high blood pressure. If your blood pressure is 130/80 or higher, then you can just consider yourself insulin resistant. Now, there's 2 skin disorders, skin tags and dark skin patches under your arms, on your elbows, on your knees. Those are indicators that you're insulin resistant. If you have those, you know what I'm talking about. Mine, when I was diabetic, I had an elbow that was dark and scaly, and it would catch on my shirts and on everything, and it ran from around my elbow all the way down to here. That's a sign of insulin resistance. So this is one of the places I check on myself, on other people. It's how I caught prediabetes on my granddaughter. After I knew, when I saw it on her, we went and got her tested. She came out as pre-diabetic. We started her on the system. Now she's not diabetic, and she's lost weight, and her moods are better, and she's just a joy. And she's actually having more cognitive function since we've got the insulin resistance down for her. So high blood pressure, skin tags, or those dark skin patches. So the skin tags are going to show up in the same place. Those little nodules of skin that are poking out on your neck, on your eyelids, under your arms, in your groin, those are a sign of insulin resistance. Got them? You're insulin resistant. Now, the other 2 in these top 5 are going to be this: metabolic infertility, and that means PCOS or polycystic ovarian syndrome, and that means erectile dysfunction. Those 2 things are insulin resistance. So if you have any of those 5, start treating yourself as if you're insulin resistant. Now, there's a couple of other cues. If you're constantly having aches and pains called fibromyalgia throughout your body, that could be insulin resistance. If you're having migraine headaches and you have hunger pains, or you're just hungry for sugar all the time and you just can't seem to get full, those are signs. If you're going to the bathroom all night long, I thought, oh, it's just because I hydrate. Well, you know what? I still hydrate the same, but I don't wake up once to go to the bathroom in the night now at all, where I was waking up 3 times a night to go use the restroom. Yeah, I was diabetic and was denying it. So that's a sign of insulin resistance even before you become diabetic. Um, so we did migraines, headaches, body aches, and pains. Oh, if you start feeling cold after you eat, or your energy levels drop after you eat, you're insulin resistant. So that's a number of ways. I also have a few videos in the How to Tell tab. I would go watch that tab. There's only like 3 or 4 videos in there, but go watch those. Those will give you a really great idea of how to know if you're insulin resistant or not. I hope that helps. Um, okay, guys, I'm going to hop off. Tomorrow we are going to dive into the GLP-1s. And man, you know what, though? I do have to say this. I don't know if that gentleman is still on, but my guy Jason was nearly 400 pounds. They wanted to put him on the GLP-1s. He was like, no, I'm not going to do that damage. They wanted to do they wanted to have him have gastric bypass surgery. He wouldn't do that. And in desperation, he found me. He found the system almost 2 years ago, and he's lost over 160 pounds. But he didn't have all the negative side effects, and he actually nourished his body instead of tearing it down. It's a choice you get to make. We'll talk about GLP-1s tomorrow, and have a good day, you guys. Thanks for hanging out with me again. Appreciate all of you. Look, I'm not here to hurt anyone's feelings, to gaslight anyone, to any of that. I'm just here to deliver the scientific information that I find, hopefully give you guys some truths that you're not getting anywhere else, so you can make better decisions. Because most people that I know of that have done GLP-1s are doing it because it's what their doctor told them, and they were told it was healthy. They were not told all the side effects. They were not told all the long-term implications. They were not told all of that. I can't hold people responsible for that part, right? Nor do I want to. But I want to give you enough information to be able to make better choices. For me, the better choice was two real food products that I take at 3 points during the day that reversed everything that 13 medications weren't handling. So tomorrow, GLP-1 drugs. We'll talk to you in the morning. Have a great day, guys.